SITAVIG is a breakthrough treatment for cold sores that directly targets the herpes virus at the site of viral replication, the oral mucosa. SITAVIG is applied to the upper gum and concentrates a sustained topical delivery over 12 to 14 hours directly to the oral mucosa and lips. As a result, blister lesions may be blocked and the number of future cold sore episodes may be reduced. Some of the most common triggers for viral reactivation include stress, exposure to sunlight, illness, fatigue, injury or trauma, and hormonal changes. Latent viral reservoirs of the herpes labialis virus exist in the nervous system and in the soft tissue of the oral mucosa. Reactivation of the virus is often marked by pain, burning, itching, or tingling at the site where a blister later erupts. Most patients who suffer from frequent outbreaks become very familiar with the specific symptoms they experienced before an episode. Upon reactivation, the virus begins to replicate in the basal layer of the oral mucosa, which can lead to the formation of vesicles or blisters. As the vesicles develop, they rupture and crust over within a few days. The blisters typically heal within 2 weeks. After the cold sore heals, the virus returns to its reservoirs in the oral mucosa and nervous system, waiting for the next triggering event. SITAVIG was specifically designed to deliver drug directly to where HSV-1 resides and replicates. Using Loriad technology, SITAVIG adheres to the gum just above the incisor and steadily delivers acyclovir to achieve a sustained concentration in the oral mucosa. If applied when symptoms first appear, SITAVIG sustains high concentrations of acyclovir during and beyond the crucial 8 to 12 hours from the onset of symptoms when viral replication is at its highest. SITAVIG concentrates medicine where it is needed. Acyclovir concentration is high in the saliva and labial tissues, while plasma concentrations remain low. In contrast, oral dosing results in a high plasma concentration, a very low concentration of acyclovir in the saliva, and undetectable levels in the labial tissue. Also, acyclovir levels in these target tissues remain high for more than 24 hours following a single dose of SITAVIG, whereas the short half-life of oral antivirals causes multiple peaks and valleys in concentration, which may allow rapid expansion of herpes viruses during periods of low concentration. 35% of patients who received a single dose of SITAVIG remained blister-free and never developed a vesicular lesion. These abortive episodes contributed to the average time to healing being a full day less in the SITAVIG group when compared to placebo. And patients on SITAVIG experienced an average of 105 more days before having another outbreak compared to patients receiving placebo. This means fewer episodes over time. SITAVIG's targeted delivery system may play a role in reducing the number of outbreaks by sustaining therapeutic levels of acyclovir at the site of viral replication during the replication window, thereby leaving fewer surviving virions to return to latency. SITAVIG should not be used in patients with known hypersensitivity to acyclovir, milk protein concentrate, or other components of the product. SITAVIG has not been studied in pregnant women or in immunocompromised patients, and no interaction studies have been performed. SITAVIG's safety and efficacy have not been established in pediatric patients. SITAVIG is a pregnancy Category B product, therefore it should be used during pregnancy only if the potential benefit outweighs the potential risk to the fetus. It is not known if SITAVIG is excreted in breast milk, however, systemic absorption is minimal. In a controlled clinical trial, the most common side effects with SITAVIG therapy were headache, which was experienced by 3% of patients, and dizziness, lethargy, gingival pain, aphthous stomatitis, application site pain, application site irritation, erythema, and rash, each experienced by 1% of patients. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Visit SITAVIG.com for full prescribing information. Ask your Cipher Pharmaceuticals representative for special offers when prescribing SITAVIG.